Hello, good morning, everyone, and welcome to this chat about the COVID-19 and treatments of fertility. Welcome, everyone. I would like to give you some guidelines, and later we can answer all your questions. Well, it's clear that infertility is a disease, and once the risk of COVID-19 is decreasing, all treatments can be restarted for any clinical indication, but in line with local regulation. This is very important because depending on the country, depending on the city, depending on the state, the rules are quite different. Currently in Spain, we are facing with a dramatic decrease in the incidence of this disease, with an improvement of the health situation, and the Spanish authority, in line with other European countries, allows today to reopening all the clinics for treating infertility disorders. But it's not to consider very important aspects. First of all, there is a lack of treatments for the virus. The only way to preserve our health is to keep safe, not abandon the measures for preventing the infections. Vigilance and measured steps must be taken for safe practice and to minimize the risk associated to COVID-19 patients or staff. For patients, it's important to consider that some group of patients are at high risk. For instance, diabetes, hypertension, immunosuppressants therapy, transplant patient, etc., should avoid the start of the treatment until the medical condition improve. On the other hand, all the patient as well as staff should follow a code of conduct for preserving and maintaining all the measures of security before the consultation, during the consultation, during the treatment, and after the pickup or after the embryo transfer. In order to explain much better, because I have been receiving many questions about the real value of the test, the relevance of the importance of each test, I prepare like a very, I'm playing with 3 colors, with 3 balls. It's a game for you in order to a better understanding. Well, red ball is the virus. Virus is in the respiratory system, in the nose, in the throat, in the lung. And virus can be detected by PCR. PCR is the test for detecting if we have virus or not. The sample is coming from the nose, is coming from the throat, okay? And is the sample for detecting the virus in our body, because it's of relevant importance to consider that the virus is not transmitted by blood, is not transmitted by sexual intercourse, is not transmitted by stools. The main way for transmission of the virus is by respiratory. Okay? Well, PCR is for detecting the virus. In case of positive PCR, we reject any kind of treatment until the patient has a full recovery. On the other hand, we have the quick or fast test. The fast test is designed for knowing the immunological status of the patient. And there are 2 kinds of antibodies against the virus. Orange ball. Orange ball represents the response of our immunological system against the virus. After the infection, our immunological system start producing large amounts of one protein called IgM, plus another one called IgG. Okay? IgM disappear some weeks after the infection, and only the green ball, only IgG is in our body for at least 2 years, and IgG is the best immunological test, because in case of positive IgG means that the patient is free of risk, and as well, in case of pregnancy, the mother will protect the embryo against the virus, because the defense of the mother take care as well of the baby. So if we have patient with IgG positive, is the best situation, because means that you can carry out any treatment without risk, neither for mothers or father, nor for embryos. So this is a very, very important immunological system. Well, depending on the questionnaire of security, we ask for some tests or not. I mean that not all the patients need the same test. In order to achieve a balance between safety and cost, we design several protocols depending on the personal situation of the patients. But in general, in case of positive PCR, we stop the treatment and we avoid transfer of the embryos, because there is a lack of information about the putative risk in the embryos affected by the virus in the first weeks of pregnancy. We have as well, we have been collecting information. We at the very beginning of the pandemic, we create a COVID-19 task force. In this task force, embryologists, geneticians, molecular biologists, and doctors collected information, and we designed some protocols and guidelines, either for patients and for staff. And you can access to all this information, and we will be more than happy providing all this information for you before, during, and after the treatment. So don't hesitate to ask for these brochures of information, and we will be more than happy sending home. Well, and now it's time for answering some of the questions. And the first one is, well, hi, doctor. I want to be a single mother. It's true that the coronavirus is not transmitted by semen? Yes, it's true. So this is a very important question, because COVID-19 is not a sexual transmitted infection. Semen, vagina, placenta, ovaries, uterus, amniotic fluid are free of virus. Other virus, for instance, hepatitis, can be transmitted by sperm or by blood, but it's not the case of COVID-19. COVID-19, the way of transmission is aerial. Sure, this is the reason, because all over the world, the scientific society or the governments don't forbid the sexual intercourse without protection, because it's not a sexual transmitted infection. So you can use a sperm donor without problem. But in our situation, in our clinic, we check all the donors, either females and male donor, in order to prevent any risk for the patient itself or the donor itself, and as well for the staff taking care of the donor. Well, I have another question. The question is from Megan. She asked me, is it safe to start the reproductive treatment? No. How measures have been taken in the clinic to avoid the coronavirus? Well, for the staff has been training by our research, but our research department as well for our quality control department and the human resources department, and we create a platform and we check periodically the health of all the staff involved in the treatment of the patients. For patients, the study depends on the previous situation. The first step is to complete a questionnaire. It's a questionnaire following the guidelines of the European Society of Human Reproduction and Embryology, and this questionnaire is for both members of the couples. If the questionnaire is completely normal, we don't need to ask further tests for the male or for the female partner of the patient. For patient, before the stimulation, we check the antibodies. In case of positive IgG, we can proceed without any risk, and you don't need to repeat any more tests. It's a waste of time, a waste of money. No, it's nonsense. In case of positive IgG, come on, don't worry about it. You can proceed for ovarian pickup, for embryo transfer, and for your pregnancy. Okay. In case of negative antibodies, a few days before the pickup, we carry out a PCR for detecting the presence of not of the virus, because the anesthesiologist forbid any kind of procedure in case of PCR positive. In this case, we wait around 3 weeks, the time for promoting in your body the production of antibodies. And once we reassure that the antibodies IgG is positive, we can proceed. In case of negative everything, a few days or the day before the embryo transfer, we check again PCR. In case of positive PCR, our suggestion is freeze the embryo. But it's just a suggestion. And the question is that we have a lot of information about the second half of the pregnancy. And we know that over the 5th, 6 months of pregnancy, there is not risk in case of infection for the baby. But there is a lack of information affecting the first steps of the pregnancy, because it's a disease with only 4 months, and we don't know if there is some risk of malformation or abnormality in the embryo produced by or due to the virus. But according to the information coming from other infection of other virus from the same family in the past, we didn't detect an increase in the malformation of the embryos or fetal abnormalities due to this kind of virus. But we don't have enough information for a completely zero risk. And in this case, in case of negative PCR, we can transfer or we can freeze, and it's dependent on you. Some patients prefer freeze the embryo and wait 5-6 months until the collection of the information will be enormous. On the other hand, some patients, based on the previous experience with other similar virus, prefer don't delay the transfer and transfer at the same time, or the same cycle. But it depends as well on you, and of course it depends on your immunological status. Please remember, in red balls, PCR positive, forget it. Green ball, IgG positive, do it. No problem, free of complications. How do you know if you have IgG positive in a test, in a blood test? The PCR is taken from nose and throat, and the quick or fast test, we take a drop of blood in your finger, and we have the result in 15 minutes. And as well, it's very important to just a comment. Some tests only can detect the mixture of both antibodies. Other tests, more accurate, can discriminate between M and G antibodies. The test we perform can detect if the antibody is the group M or is the group G. In case of G, remember, green ball, and come on. Well, the question is just a blood test. And the second question is, good morning, coronary leads consequence infertility and in children, thank you much. Well, infertility, female, there is not virus, neither in uterus, nor in the ovary, nor in the oocytes. We can reassure that there is not, according to the current evidence, there is not relationship between ovarian reserve and infection for virus. No relationship. But in the males, around 50% of infected males with severe symptoms can have an inflammation of the testes called orchitis. Orchitis can impair the future activity of the testes. In case of normal sperm, usually we don't recommend any extra measure. If the male is suffering from low quality of the sperm, it seems very prudent to freeze the sperm in order to preserve a theoretical decrease of the capability of the testes for producing new ones. So, in summary, for females, no worries about fertility disorders affecting the ovarian reserve. For males, in case of normal sperm, don't worry. In case of previous abnormal sperm, we recommend freeze sperm, just in case of future impairments in the testicular function. In children, not at all. There is no transmission from mother to children. There is a lack of virus in placenta and amniotic fluid, in the cord, amniotic cord at the time of the birth of the baby, or the delivery of the baby. And furthermore, you can feed your baby. You can feed the baby. No, there is no transmission by the maternal milk. And you say, do you have the test before traveling on an international flight? Will we be able to fly over? Well, when will international patient be able to fly over? It's not my question. Sorry, I can't do anything more. This is a question of the authorities, civil authorities for civil flights. As far as I know, in European countries, probably at the beginning of June, the domestic flights will be permitted. And the other part of the question is, do you have the test before traveling? So, in order to avoid unnecessary trips to Spain, we suggest the first visit by teleconference, by Skype, for instance, or other systems. In this first visit, if you need some tests, you can do the test in your country, avoiding an unnecessary trip to Spain. Of course, if you have problem for performing the test in your country, feel free and ask for the test here in Instituto Bernabeu. You can send the sample, it's quite easy. My staff will provide all the information for sending the sample. But we suggest first visit by teleconference, telemedicine. We are thinking about a donation. Is there a risk of contracting the virus from the donor? Not at all. But we perform the same test for donors as for patients, because for us, donor is a patient as well. It's an altruistic patient, but it's a patient. deserving the same care that the other patients. And the protocol for testing are exactly the same. But in order to reassure the health of the patient and the health of the staff taking care of the patient. But there is no risk of transmission, neither by sperm nor from the oocyte, from the egg. I get the virus. Is there risk for the baby? Can it cause? The question is if the virus can it cause premature birth. Not really. So the question is, in case of fever, fever itself or severe diseases can promote the trigger of uterine contraction, a preterm labor, but not by the virus itself. So if you don't have an profound impairment of your health, don't worry about it. Don't worry about it. The transmission from mother to baby during the pregnancy is exceptional and it's not usual. So my recommendation is 2 or 3 weeks after the virus was detected, carry out a test for know if you have AGM and AGG. And in case of green ball, don't worry, you are protecting your baby every day, every minute. And the question is, the second question is, I live in Australia. When do you foresee us being able to travel to Spain for donor treatment? Again, before coming to Spain, please ask for an appointment by a teleconference. In this way, we can make easier, faster, more affordable for you the treatment. And in my opinion, this is the first step. And this way, when you will come to Spain, everything has been previously prepared, and you don't need to spend more travel or a long stay with us. But no problem at all. The question is the legal restriction for flying, not for medical restrictions. The second question is, hi doctor, I'm afraid the virus pandemic will be too long and the way too long as well. Yes, please don't forget that the virus is with us, between us, and the virus will be here for a long time. And the only way before the vaccination arrives is to take good care and follow the instruction for mitigating the risk of infection. So, in fact, the experts suggest a new wave of the virus in Europe after the summer. So it's very important to don't forget that the virus is living between us, is with us, and the virus will be here until the massive vaccination will be available. And the second question of this same lady is, will anonymity laws change with the pandemic? I don't know. I hope that not, because probably this is not the important matter of concern for the authorities at this time. No, I think that no, but it's a legal question. But I think that in Spain, the anonymity will be maintained for the future. Another question is, these blood tests are not public available. How can patient get the, yes, please, my staff will take care of your question and will send to you the information for performing the test. You can send us the sample and we can do it here in Spain. It is possible to fly the frozen embryos to other countries to perform and transfer in another country? No, it's forbidden. Now, currently, the European authorities forbid the transfer between countries of any sperm sample, any oocyte sample, any embryos. It's completely forbidden. Nowadays, probably in a next future, the barrier will be open, but now it's forbidden. The other question is another patient as well from Australia. She asked us, it was about to get a donor transfer in March and treatment cycle got cancelled halfway through. When do you think we will be able to resume treatment again? If you are living in Australia, so you can do the test. My suggestion is perform PCR plus antibodies, because depending on the situation, we can go faster or not. For instance, again, please don't forget green ball, AGG positive, PCR negative. Come on, let's go. Don't worry about it. It's not a matter of concern. Okay, so this is the best situation, not only for you, as well for your relatives, for your friends, for your family, and for your future baby, because you are protecting you and your embryo as well. You cannot infect your relative or your loved ones. No problem at all. So we can resume the treatment whenever you want. So once again, the limitation is the restriction for flying. This is the limitation. If I traveling from overseas, will be have to be quarantined before attending? Not necessary. The first step is answer the questionnaire. My staff will send you the questionnaire for you and your partner. If you have partner, you are a single lady, of course, it's not necessary. In case of same-sex couples, it's mandatory to check both members of the couple. Okay, so but it's not necessary to be quarantined before. Depending depending on the immunological status. You say, do we have to do the IG test again when we land? No. Again, please don't forget green ball. Green ball means at least 2 years of protection. Don't repeat it. It's not necessary. So green ball is the best for us, for all of us. Another question is Mrs. Cathy. Cathy asks me, I take hydrochloroquine daily. Oh, wonderful. Well, so it's quite amazing. So as you know, we use hydroxychloroquine in some cases of repeat implantation failure, or in case of repeat pregnancy losses due to immunological disorders. Of course, if you're taking hydrochloroquine for immunological disorders, or for repeat implantation failure, or for repeat pregnancy losses, you can follow the treatment, because as well it's an immunological modulation for the response against the virus, and as well decrease the level of virus release in the lung due to the hydrochloroquine. So you can take it, no problem at all. Because actually it's not, hydrochloroquine is not a suppressor of the immunological system. It's very important. It's an immunomodulation. It's not the same concept. So it's in case of immunotherapy. For immunosuppression, don't do the treatment, because you cannot create a high level of antibodies against the virus. You are not protected. You have a high risk of develop a serious medical condition. If you are taking immunosuppressive drugs. But hydrochloroquine is not an immunosuppression drug, it's an immunomodulation. You can take it without any risk for a high risk of suffering the COVID infection or the COVID consequences on the infection. You can use it. You are not at risk, because you are not taking immunosuppressive drugs. Okay? And this group, I have another question here. Yes, another question. Some patient asks, can I do extra tests for my safety? You can do it. We can create several protocols depending on the status of the patient. So it means that not all the patient should be screened, and not all the screened patient should be screened for the same. Some patients should be screened for virus, PCR, other only for antibodies, and other for all the tests. And depending on the medical condition and depending on the questionnaire, we can ask for one or another type of studies. But some patients prefer, in order to feel more relaxed, well, I would like to do the test because in my work, in my job, or in my neighborhood, it's a risk. I would like to do the test. I can do it. Of course, you can do it. The limitation is the number of tests available. This is the limitation. But in our center, because we have a very robust lab of molecular biology, performing PCR for embryos, for DNA, for RNA, etc., for us is not a matter of concern. Currently, we have tests, not us. No, we don't have thousands of tests, but we have enough tests for our patient and as well for our staff. Megan says, hi Megan. I am hypertensive and I am in treatment. Do I have more risk? Yes, you have risk. So yes, you are at the group of high risk patients. One of the reasons is because the virus use the gate of the virus for go inside the cells is the receptor. It's a receptor, and the drugs used for treating the hypertension are related as well to this cellular receptor in the membrane of the cells, and you are at high risk. So in my suggestion is delay the treatment. Please ask to your doctor, do the test, and again, if you have green ball, IgG positive, you can do it because you are protected. But if you have negative IgG, wait and delay the treatment. This another question. I understood that you not send sperm or embryos to your clinic or to another country. It's forbidden. No sperm nor embryo nor eggs. It's forbidden. Currently, it's forbidden to send any kind of material, organic material to other countries. It's forbidden. In the future, we hope to restart again because we send for some countries, we send eggs for some countries, but currently it's forbidden. And now when we send either sperm or eggs to other countries, we put as well together the certificate of the test has been done for donors. Well, any more questions? Well, thank you very much for your attention, and I hope that you and your loved ones will be free of any complication, and my best wishes for everyone. If you have any question, please don't hesitate to contact with us. We can send you all the brochures and instruction and guidelines for any step of the treatment before, during, and after the treatment. And thank you very much for your attention. Bye-bye, and all my best.